Good, honey, good.
We've been involved with service education since the beginning of the dental hygiene program, and over the years we increased our service to the underserved. We certainly do a lot of that in Connecticut and inner cities, in Hartford and Britain and Waterbury. And then we got involved with one of my colleagues with the Native American Studies program, and she suggested we come out to the Navajo Reservation. This is our 5th trip out here. We have done a number of dental assessments on the children in grammar schools and high schools in Monument Valley and in Montezuma Creek.
Right now they just have an earthquake drill. A lot of them we already seen before, so they're very familiar.
Well, I think it's a wonderful opportunity for the people in this area to have the students' teeth checked. Most of our kids' teeth are in pretty bad shape. Part of it is living a distance away from. They don't live in communities with controlled water, and so they usually have to haul water. So there's not fluoride in the water like there is in most cities. So that may be a factor as well. It would be great if they could come back. Yes, we would love for them to continue because they're very efficient, they're very organized, they have it down to a quick pace and a science, and they're very good with the children.
You're going to dry your teeth real quick and put that fluoride under that mineral that makes your teeth nice and strong.
We're having a very good day. I think the children have been fantastic. The support staff here has been remarkable, and it's going very well.
This is the 3rd year that we've come out with mobile dental units. We go into the school. The last couple of years, combined, we've placed 300 sealants, and we're hoping this year we can even do a little better than that. We would like to continue to come back here as long as we can raise the money to do that. We're making a difference.
Early childhood care. That would be a good way for us to segue into the benefit of fluoride.
We knew that this population was going to have a higher prevalence and incidence of tooth decay, which is what we expected. But what we're finding and what the literature is showing, that the lower ages is where there's a big problem. The baby teeth had lots and lots of decay, but as the kids got older, we found that the teeth were stronger and that they were more aware of practices that would help to promote good oral health. So I think from our standpoint in the future, I'd like to focus on any kind of thing that we could do to help prevent tooth decay in the very, very young.
I was able to spend a full day at the high school with Mary Bensavango, and we had an opportunity to screen all of the children from 7th grade to 12th grade. We were a little discouraged, and we were sort of expecting it as some of the eating behaviors. The students were eating the food right throughout the day, drinking the sweet drinks that were available at the school.
I see an improvement in the dental IQ. The fact that we had a number of children that were in orthodontic treatment surprised me, because 4 years ago you would not have seen as many kids having ortho done. But the children that lack care, we have almost like 2 levels. There are kids that are being treated and are being very meticulous about their care, and I think the effects of sealants, we saw many more children with sealants than we have in the past. So I'm encouraged, but there are still concerns for the population that is not receiving any care.
We use fluoride because it's a naturally occurring mineral that helps to remineralize and strengthen the enamel of the teeth, and that helps to lower the risk for cavities. So I believe that fluoride would be very beneficial for them to help reduce the amount of decay and cavities that they have.
And one thing that I really took back from this experience was noticing the difference between the children that were born and raised in a community with fluoride, such as Salt Lake City, and moved here, and a child that was born maybe on the Navajo Reservation that has always had unfluoridated water, and the difference between the decay and the cavities that they had and the strength of the teeth. And it was just really, we learned about it, we read textbooks, but to come out here and to see the actual benefits of the fluoride on the tooth was very interesting, and was one of the things that I'm going to take away from this experience.
Things really seem to be on a good, positive track, and I'd like to work collaboratively with the dental community, the tribal community, and come together collaboratively and find out how we can all work together to do what's best for the children in a culturally sensitive and positive manner.
So I think if we come out again, and every year we've made more progress, people have listened to us every time we've come, and it's improved every time, and the children, I think, have benefited. It's very important, and it certainly is educationally worthwhile.